Good afternoon. I'm Dominic Harrington, the Chief Scientific Officer for Viapath, and I'm here to introduce the shortlisted projects for the Viapath Award for Innovation in Healthcare. The shortlisted projects are improving compliance with the minimum acceptance criteria for laboratory requests from Belfast Health and Social Care Trust, Wales Infants and Children's Genome Service from the All Wales Medical Genomics Service, emergency blood provision to the NHS Nightingale Hospital North West from the Transfusion Laboratory Services, Manchester University NHS Foundation Trust. Let's hear more about them.
In this data-driven world, amazingly, clinical laboratories still struggle with missing or incomplete information on samples received for testing. This is a patient safety risk and can lead to critical results not being communicated in time, results not being available on relevant IT systems, repeated blood sampling or wrong tests being performed. Get it right first time. It was our aim to ensure the safest possible blood sampling by improving the quality of information received with a patient sample, first time, every time.
Our minimum acceptance criteria, MAC, project involved a communication blitz to inform our many stakeholders of the hazards caused by missing information. We developed definitive procedures for staff on how to handle samples that did not meet the minimum acceptance criteria. Communication and representation across the different lab disciplines was key to success. We proactively engaged with users, gathered support from Trust Executive Team and worked with senior medical staff. The implementation and enforcement of the MAC started in September 2019.
1 year from the initial implementation, there has been a drop in the number of sample requests received not meeting the MAC by almost 70%, with less than 1% of samples now being rejected. This project has been so successful that it has been put forward for adoption across Northern Ireland. Promotion of electronic requesting will allow for easier provision of the MAC. We have a plan for regular refresher education for lab staff and users. This project fostered great engagement with our users, and we wish to use this platform to deliver further pre-analytical quality improvements and continue to promote the lab and the lab role in patient safety.
My name is Sian Corrin and I am a clinical scientist and part of the development team for the Wales Infants and Children's Genome Service, the WINGS service. Recent research has shown that a significant proportion of very seriously unwell children in the neonatal or paediatric intensive care units will have an underlying genetic diagnosis. It has been shown that finding a rapid diagnosis for these patients leads to fewer days in hospital, targets treatments, avoids unnecessary invasive procedures and prevents future avoidable harm. However, using previously available genetic testing strategies, finding this diagnosis could sometimes take months, if not years. Therefore, in April 2020, we launched the WINGS service in order to try and find a diagnosis for patients and their families within 2 weeks. This service was the first commissioned NHS diagnostic whole genome sequencing service in the UK. Implementing the service involved a multidisciplinary approach with colleagues from the All Wales Medical Genomics Service, neonatology and paediatrics, and Cardiff University working together to develop both laboratory and clinical pathways. A crucial part of developing this service was gaining insight and input from the public and from patients. This was achieved through consultation with the Genomics Partnership Wales Patient and Public Sounding Board and with the Cardiff and Vale Youth Board. When establishing this service, we utilised many new technologies and skills within the department in order to deliver the service that we wanted to. Since this service started in April 2020, we have tested 20 patients and found a diagnosis for 7 of them. For a number of these patients, this diagnosis has directly changed their management and improved their outcome.
Blood provision in a box. MFT's contribution to the Nightingale project. Due to the distance of the Nightingale Hospital from Oxford Road campus, the transfusion service was asked to supply on-site ORHD negative red cells for emergency blood provision to safeguard all Nightingale patients against major hemorrhage. We needed a quick, creative and safe way to bring the blood closer to the patient. Many options were considered, but after seeing the already successful collaboration between the NHS and the military, we decided what better way to support the war on COVID-19 but to respond in a military fashion. This is where we got the idea for blood provision in a box. Golden hour technology was our solution, originally designed for the military to protect temperature-sensitive components in the battlefield. It assured us of temperature-controlled environment for a specified time if unopened. We initially validated the box for short periods and exchanged them in shorter timeframes, while other boxes received their full 120-hour validation, ensuring early provision of products while sequentially increasing our storage times. Transfusion practitioners and managerial teams wrote documentation and carried out training as it evolved, while we developed and proofread for feasibility, significantly reducing deployment time. Daily checks and detailed end-user instructions and documentation allowed us to meet our legal obligations of vein-to-vein traceability. This was truly a cross-site, multidisciplinary collaboration at a pace we are rarely accustomed to meet an immediate and critical need. We are rightly proud of our team's accomplishments, particularly considering we were separate trusts not many months before, and were forging new working relationships in a rapidly changing landscape.
Fantastic, said the judges. This winning project was potentially transformative in terms of improving patient pathways, developing the workforce and supporting future innovation. And the winner is Wales Infants and Children's Genome Service, the All Wales Medical Genomics Service. Congratulations.
I'd like to say a massive thank you on behalf of the whole Wings team and everyone involved in setting up this service for this award. And also a huge thank you from the Wings team to everyone involved in supporting this service, including the Patient and Public Sounding Board and the Cardiff and Vale Youth Board. It is vitally important that we continue to utilise cutting-edge genomic technologies within mainstream healthcare to achieve the best possible outcome for patients and their families. And hopefully this is the first of many services that will help us to achieve this aim. So thank you very much.